Welcome to Moments with Marianne. I'm so delighted we're spending this time here today. We have a very empowering show coming right up with special guest, Dr. Robert London, and he's here today to share with us his new book, Find Freedom Fast, Short-Term Therapy That Works. Now, Dr. London is a well-known psychiatrist, educator, and writer. A practitioner for over 40 years, he's the founder and former head of the short-term psychotherapy unit at NYU Medical Center and a pioneer in consumer health care, radio, and television programming. His articles and columns appear in his own newspaper, as well as leading medical journals and popular magazines. He is a frequent source for national TV, radio, and print outlets. So let's welcome to the show, Dr. Robert London.
Thank you very much for having me.
What an honor it is to have you here. And my goodness, your book is helping so many people. As an author, you should be so proud.
Well, it took a number of years to put it together. I've been writing newspaper columns for about 35 years. And finally, I decided that a few years back that I would try and put it together. A good friend of mine who was a professional writer of novels and such kept edging me on to please do it, and I finally did it. It took a lot of time, a lot of work, a lot of research, a lot of effort. But I put together a lot of material that was also part of my thinking and doing the newspaper columns for so many years. And it's a very interesting book as far as because it's my book and I wrote it. And it's interesting because it's different from other self-help books. Besides showing a route of how to help yourself, it has three parts because it talks about me in terms of why I became a psychiatrist after medical school, and it describes some of the problems that the book identifies: anxiety, phobias, post-traumatic stress disorder, much of which I've treated over the years. And then it goes into specific composites of different people and how they did well with those things. And it's very interesting because I was encouraged very much when I started out by my father. My father was an eye surgeon. My uncle was a general surgeon. And I talk about that in the book. And when I told him I was interested in psychiatry, I was always interested in surgery because I was actually joining my father in the operating room when I was in medical school and watching him work. And I was always interested in surgery, and then I realized I liked watching it and reading about it and hearing about it more than doing it. It was not the kind of life for me. And I was attracted to psychiatry and was very comfortable in my rotations in medical school. And my father was a bit surprised, and he was saying, well, it's long hospitalizations, it's side effects from medication, or you're just sitting in a chair for years and years and years. And then he said, if you're going to do this and be a psychiatrist, go out and learn something that the other folks don't know. And in that, I had this surgical model from the family, which is more often, and it's also a good medical model, not always a good mental health model, where you circumscribe the problem. So I got really, real interested in short-term techniques. And after my medical school and my training, I went up in New York to Columbia University, New York Presbyterian, and I attended a course with a Dr. Herbert Spiegel, and I became his associate for about 5 or 6 years and learned about the beginnings of cognitive behavior therapy, CBT, and about relaxation techniques and hypnosis. And then I transferred it down to New York University Medical Center, where I ran the short-term therapy program for about 20 years, teaching a lot of trainees these techniques. Some of them may have gone on to use it, some may not. And so that's how I started, but it was trying to identify a symptom with a motivated person and getting them getting them back on track, and even realizing that once you had your month visits or 3 months of visits or whatever it was, you could come back 2 years later if the symptoms reoccurred. Just like you go back if you have a bad back and you get the back fixed, but 3 years later the back goes out again, you go back to see the doc or the orthopedic surgeon who took care of you. And it's made a very big difference in my career, and I enjoyed it because instead of just going on with kind of an open-end kind of discussion, you focus on the particular problem. You don't try and solve the world problems. And as you aim to solve the problem, you have the person you're working with focused on solving the problem, not necessarily getting angry at their mother and father for getting them into the situation, which unfortunately, from my understanding, too much long-term therapy goes into that. Although there are some people who will benefit not from the short term, but do need the longer term. So it's a mixed bag. But I do think more and more people could benefit just from circumscribing the problem. That's why I introduced my version of the cognitive behavior therapy, CBT, and I call it LPA, Learning, Philosophizing, and Action. You learn a little bit about what's going on, and then you try and expand it to philosophizing somewhat, and then you take action to help it. And I think it really works. And what comes to mind is a gentleman many years ago who was totally phobic about dogs. And whenever he saw a dog, he would cross the street, and he would sometimes break into a sweat. And it was just a really scary thing. And then he gets invited to visit in another state at some reunion, an old friend he went to college with. And he finds out this old friend also has a dog, and now he's really in a severe conflict. So he's motivated to see his friend, and he's motivated to get the dog phobia cured. And it turns out that he grew up. This is the learning aspect of the Learning, Philosophizing, and Action (LPA). He realized he grew up with his mother and his grandmother, who really disliked dogs. And it was a regular routine in the house to not be happy with not only dogs, but other pets. And from that learning, it became, in his life, the way his brain and he processed the information, it became a phobic response that was really dictating a good part of his life. He was a successful guy, but it was dictating a part of his life. And it's interesting because with his motivation in circumscribing the problem, he didn't have to get angry at his mother or grandmother. This is just their attitude. They didn't like dogs. There's lots of people who just love their pets and animals and dogs, and these folks exaggerated on the negative side. But he was able to still love them, and that's really a critical thing, that you don't have to go into this deeper stuff, which may have meaning or may not have any meaning at all, but it certainly is not short-term when you go into it. So what I did with him, and it was very short-lived in a sense, I recommended some books from the American Kennel Club, I believe, where he could turn the pages and look at dogs before he went to bed or on a weekend. And at first he was pretty turned off by it because those photos of the Collie, the German Shepherd, the Bernese Mountain Dog, the Rhodesian Ridgeback, they made him anxious. But as he kept looking at it, he was getting desensitized. So after about a week or 10 days, 2 weeks possibly, he started to feel better. We were in regular communication. I saw him probably twice. We went over the books, and then we needed to develop a real-world experience. So I asked him if he knew anybody who had a dog, and of course he knew a few people in his neighborhood. And we went into how much can you trust them, and he obviously could trust them. So we set up a real-life experience where he would connect with someone who had a dog, and the person would keep the dog on a leash. And slowly over a period of days and weeks, he would look at the dog from a distance, and as the days went by, walk closer to the dog, always knowing that the friend is not going to come towards him or let the dog loose. That's where the trust comes in. And so he is the master of the desensitization process. And eventually he is able to pet. This is a nice dog. It's not going to attack anybody, as most dogs don't attack people. And he eventually was able to pet the dog. And this really gave him a whole new perspective on his phobia, and it took away a lot of the pain and suffering he had secondary to this phobic response, and was able to go successfully visit his friend. Everything worked out. I never saw him again after a number of visits. And this is what short-term treatment is about. Sometimes it gets more complicated. This was fairly straightforward, but this is kind of fits in with the medical model where obviously some problems are long-standing and chronic, but oftentimes you're there there's an infection, you treat the infection. There's a sprained back, you treat the sprained back. And it goes on that way. Blood pressure goes up, you control the blood pressure. So here's an example of you learned something, you philosophized it, and then through the therapeutic situation went into the world of action and basically solved the problem. I thought that was a very good outcome.
Well, gosh, what a great outcome that is. I mean, when you look at that, just for someone being able to walk through such a strong fear and get to the other side, that's a huge deal.
It is a huge deal, and he was empowered. The point is, and it's critical that the person holding the dog is going to stay put with the dog. And that's where that trust would come in. And it worked out well, and he knew how to pick the right kind of person. And the person was equally motivated to help their friend and neighbor, as it turned out. So that was a very good. But once again, the motivation was tremendous. When I started the program at the NYU Medical Center, we started the short-term therapy program with one visit smoking cessation. And basically, we were very successful, but the success was also contingent on motivated people who wanted to stop smoking. We weren't 100% successful, maybe 30%, which was good at the time. And there were a lot more smokers back then than there are now. But we used a one-shot visit linking smoking with respecting and protecting your body, which expresses your life. It wasn't any kind of program where we said don't smoke. And from that, we did a little bit more on weight control. Weight control was really not as successful until we reduced the situation to people only 50 pounds more than their natural weight. But it still wasn't as successful as smoking. Smoking is all or nothing, where eating is something we have to do. And then this program expanded into anxieties, phobias, and before PTSD was officially named, it was doing PTSD. And it was something I ran and taught trainees for about 20 years. But basically, it started very simply with smoking cessation, and we moved into these other areas. Short term, I just believe it should be taught more often. It should be promoted in a way as not being, it shouldn't be stigmatized in terms of still so much mental health care is stigmatized. And for some people, for some mental problems, you need medication. For some mental problems, you need longer-term care. That's okay, too. But I just think people would identify much better with short-term care where they could see what the symptoms are and treat them and hopefully get rid of them and move forward and reach a greater and greater potential of their life. The dance of life, as we all know, goes very quickly, and you want to get as much done and feel more comfortable in your own skin and as successful as you possibly can as the clock goes by. And that's what short-term treatments and short-term therapy is about.
Did you, I mean, because it's interesting, we're in an age where people, it seems that people are suffering from more anxiety and phobias and PTSD and all of this. Isn't it something that you are kind of like looking back going, gosh, I'm glad I went into this field because you're helping so many people?
I'm very comfortable with it. Anything you do in life, sometimes there's frustration, and not everyone is going to succeed. But I have no problem letting the people know this is what I do. This is what I'm offering, and I think that's where being a good consumer, an intelligent consumer, a knowledgeable consumer. That's where the book also goes into how to be a good consumer and not be fearful or intimidated or shy about asking a potential therapist, whether they're a psychiatrist, psychologist, mental health social worker, nurse practitioner, or what kind of therapy do you use? And, if they can't define it, that becomes a bit of a problem. But I think you can ask, depending on what your problem is, what the approach is going to be. There may be over 1,000 or more types of psychotherapies across the world, but there are maybe 10, 12, or 15 that fit into an organized, acceptable kind of concept. And I think you need to ask, just like you would ask a lawyer what kind of will are they going to draw up, or and if you went to a lawyer to have a will drawn up and it turns out they're trying to sell you real estate, you're with the wrong lawyer. So the point is, you need to just be a good consumer, and if it turns out that your problem takes more time, that works too. But at least for circumscribing the problem and for economic reasons, and to destigmatize it, it should just be a kind of a mainstream thing where I've got this serious anxiety. Maybe it runs through the family. Maybe there's a genetic loading. Maybe I learned to be anxious. Maybe just like this man, he learned about his phobia from mama and grandmama who didn't like dogs. And it just works that way. And sometimes there's situational anxiety. This guy was phobic. I've seen a number of women over the years who are pregnant, and their anxiety is tremendous in terms of job loss or negative reactions by men in the business, because they'll have to work extra when the person is out. And sometimes you can teach these women how to relax. You can use hypnotic strategies, relaxation, guided imagery to give them to project nice things on a movie screen. I remember one person years ago who was a hostess in a restaurant, was expecting her first child, and was terrified that someone would take her job, was terrified, anxiety-ridden, because she felt that if she lost the job, she'd lose the income. And all she could think about was what was going to happen. She had really no job security, even though she'd been there for a number of years. And this anxiety was not only torturing her, the fetus doesn't do very well when mama is anxious. And you need to take off after you have a child. One of the things my father taught me, the eye surgeon, although he was an eye surgeon, but he knew a lot of medicine, was that pregnancy is not 9 months. The delivery of the baby comes after 9 months, but pregnancy is a year or more for a woman to get to know the newborn, and for the woman's body to get back into shape after all the ligaments and muscles and joints expand and the hormonal changes. So the woman knows she's got to take time off. There was a good outcome here because she really was able to, through visualization techniques, to concentrate on the joy of her first child, using projecting on a movie screen that I helped her visualize. And at the same time, she went out one night with her husband to a local restaurant, and someone recognized her in the place as working in the other place, and they offered her a job after she delivered the baby and took a rest at home. They offered her a better job than she had. So that was not therapy, but that was a fortuitous event. I think of another woman who was a partner in a law firm, and her anxiety was because the men, all men who had families and children, were very hostile that she was going to be out for 12, 16, 18 weeks, and they'd have to pick up the slack in this reasonably large law firm. And it made her feel uncomfortable, anxious, nervous. And then the treatment was pretty straightforward because we focused on the positive, okay? Let's start identifying the men in this firm who are thrilled that you're going to be out because you're going to bring a child into the world and they'll welcome you when you come back. And actually, what it did for her, and this is a very important thing in psychotherapy, it gave her a new perspective on the old set of problems. Here's this incredibly brilliant woman in a substantial law firm, great education, but yet she didn't connect with, and I don't see why anyone should, because this is what I'm offering, a new perspective on the old set of problems. The old problem was hostile people not wanting to pick up the work when she was out. Now you found those folks who are not hostile but thrilled for her. And it didn't take much to make her have the jump, but yet before she came in, She was not sleeping. She was not eating well. And she was really, you might want to say, a wreck. So sometimes that kind of stuff, without going into why do you feel the men are hostile? What does this remind you of? Are you angry at your aunt who didn't pick you up from school when you were 5 years old at the right time? So it can go on in a lot of different directions. Some people may need that, but there's a whole bunch out there that can do pretty well with this short-term strategic rethinking stuff that I define as learning, philosophizing, and action. And basically, it's my spin on cognitive behavior therapy, which is not too difficult to understand. Cognition is basically thinking. So it's thinking through what's going on and getting a new perspective on the old set of problems. Does that make some good sense to you? This is what the book is about. It defines how I got to where I am, and the influence of my father and the training programs I went through and the mentors I've had, the definition of the problems, and then a number of composites that people can look at and see how this might apply to them to just get a new perspective on the old set of problems and move forward. Change is a very elusive concept, but the big picture in talk therapy of any kind is affecting change. It's a very hard thing to measure. Essentially, only the person who changes can give you the feedback. So it's not very scientific, but that's the measure and what it's about. So that's what change is supposed to happen when someone has a difficult situation and they want to clear it up.
Yeah, it's interesting because it's really changing dramatically, one person's life at a time. And then you never know, because then they're teaching people around them, maybe kids, a new way of doing things. Like how you're talking about the gentleman that was afraid of dogs. If he's not afraid of dogs, he's not perpetuating that to people he knows.
Absolutely. That's a magnificent point because it's almost like some of the stuff is contagious, right? Mm-hmm. It's very, very, that's well put together. I couldn't do it better. Okay.
Well, your book does it. That's where I got it from.
Okay. Oh, okay. Okay. All right. I wrote the page, but I guess I forgot about that. But it is true that mm-hmm. the stuff is catching.
Yeah, and, but it's so encouraging and so empowering because there's a way out. It's not like people have to be stuck there.
No, you're right. It's like, if you taught a pre-kindergartner 2 and 2 are 3, they would go into the classroom and within a matter of minutes, the teacher would straighten out that 2 and 2 are really 4. It's a little more complicated when you get these other mental situations, whether it's a phobia or even when it's more diffuse, that you're not able to hold a job that well or you're not doing so well in relationships. But the intact brain at any age, I believe, is capable of making change. That's how we learn. Just in a simplistic way, it's the 2 and 2 are 3 or 2 and 2 are 4 model. But we're able to make a change by rethinking. And the kind of therapy I'm talking about, this learning, philosophizing, and action, LPA, gets you to think through what's going on and through your own motivation and your own empowerment, make a change. And that's what's very important. People can change, especially when you add, as I said, the motivation. But you have to offer a new perspective on an old set of problems, different roads to take. And oftentimes when someone takes a different road, it's strange in the beginning. But if you're successful on a different road 8, 9, or 10 times, it then becomes part of your brain, or it becomes part of the neurons, the chemistry, because it has to get integrated. It's not some magical process. We may not understand all the physiological and chemical processes in the brain. There's a long way to go, but somewhere it gets logged in to this magnificent thing that we humans have, our brain, and change does occur. And you start to you're able to move more forward to fulfill the promise of your life. And most everyone has certain dreams and promises. And as I said earlier, I believe the dance of life goes very fast, and it's much better not to be bogged down with something, especially if it can be remedied.
Oh, I couldn't agree with you more. I think being able to go through life in a peaceful kind of existence is kind of what people are, especially now, are really searching for, because it seems like that people just have so much anxiety and there's so much that's going on that it's kind of in the forefront that these issues need to be addressed.
If you can address them without feeling that you have to hide, and you can reduce the stigma, that makes it even better. But the stereotype of some of the talk therapy is that it's open-ended, goes on forever, and unfortunately, the feedback that I've gotten over a 40-year period is too many people end up being angry at important people in their life. Now, there may be some important people in your life you should be angry at, but in my experience, talking to so many people, the blame game seems to dominate too many therapeutic situations. And as I said, once in a while there is a blame game, but I don't think that's where to go in terms of going. You take a time shuttle once in a while to find out, like the person with the dog phobia did grow up hearing negative things about dogs, but that doesn't mean it has to be there talking about mama and grandmama for a year and a half. That means this is how you learned it, and a receptive mind can grasp that. If they can't grasp it, you work a little harder, you take a little bit longer to see if you can find some other way of integrating how this happened, and then you still work and philosophize about it, but the big picture is what kind of action can we now develop to rid the person of, say in this case, in past case, the phobia. But basically, it's got to be done in a positive way, and let someone expand and reach their potential as far as I can see. And that's what short term is about. It is not going to work for everybody. As I said, and there are times when medication is necessary, and many of the medications work and are very effective as long as it's being used by someone who knows what they're doing, and it's kind of approved for what you're treating, and you're able to realize if one medication isn't working, you take it away and you try something else. And one of the problems is sometimes if one medication is not working, another one is added, and then maybe a third one is added without taking away the first one. That can always be a problem. But this book is not necessarily about that. It does point it out. But the book is basically focusing on short-term strategies and how far more people could be served by it, and there'd be less stigma, because it would be like just going for your annual checkup. And if you get better, you want to come back 2 years later, most therapists, regardless of what your degree, they're going to remember you, and you'll get a refresher course. That's how I think it should be as a universal concept. So once again, short term should be first as a trial, and you see where it goes. It takes a lot of work. It takes a lot of creativity. You got to put a lot out, but the person receiving the care has to be able to be open to put a lot out in terms of their motivation and their willingness to try new things. And you try it, in a careful, conservative way. I mean, like I said, with the dog thing, you make sure the dog is always on that leash and never allowed to run towards the person who's getting desensitized from the phobia.
Yeah. Well, and I have to applaud you, Doctor. I mean, because you have really dedicated your life to this work, and it's, again, I know I'm, kind of sounding like a broken record here, but it is really helping so many people, especially at this time in our history, I believe. And your book, Find Freedom Fast, is a way to help people to get there, because I'm sure you can only see so many people a day, a week, and what have you,
Well, the book is meant to reach more people. Many of the newspaper columns I wrote were for medical magazines, so it didn't reach that many people. Some were for general circulation. But this book is meant to reach professionals as well as people who may get something out of it to affect their own lives and motivate them to move forward and realize that, as I said earlier, a new perspective on the old set of problems. I never get a break. Well, no, most of us do get a break. We just have to recognize it. Getting away from all or nothing. So many people speak in terms of all or nothing. So many people speak in terms of yes, but. This man with the dog phobia, he didn't say, "Oh, I know my friend is going to let the dog chase after me." That would have made it a little more complicated. He just had complete trust in the friend and neighbor. So that worked out. But it can get more complicated. But you have to be able to have the flexibility to go with the complications too. Not challenging anyone, not fighting with anybody, but to just keep diligently working at offering someone a new way of thinking. And you hope that new way of thinking, when it's successful, will become part of who they are. So it stays with them for a very long time. But if it doesn't stay with them, they show up. And when someone shows up for a second or a third time, it's very quick, because the refresher just does just that. It refreshes you. It's just like meeting someone from high school who you might not have seen for 20 or 30 years, and you can take up a conversation as if you were next door neighbors for those last 20 or 30 years. At the same time, though, it's 30 years later. And we've all had that experience where... In fact,
I just had that recently.
Yeah, and that's just a tribute to not only the complications of our brain, but how well the brain works. That you can go back on a time shuttle for 30 years with somebody, and at the same time, you can talk about what you're doing in your career. You can explain your family. You can tell them where you live. You can exchange phone numbers, addresses, emails. And at the same time, you're back in high school or college or at the first job you may have had. And what a wonderful thing. And it's almost like you never experienced a 30-year gap. And you said you just experienced something like that. It's quite amazing. It's quite amazing. And so our brain has this wonderful ability to change. It just has to find the right roadmap, the right pathway to do that. And I was hoping that this book, which you can get, by the way, on Amazon, will help somebody see that, or search out someone in their community who does this kind of work, this first starting with short-term approaches and focusing on the specific problem, not on some big philosophical set of ideas.
Well, and Doctor, we could talk forever because you're such a fount of information in regards to this, and your book is such a great resource. Where can our listeners connect with you and be part of your community?
Well, I have a website called findfreedomfast.com, and that will lead someone into a connection.
And they can go from there. Yeah.
Yes.
And you have ways that they can reach out to you and of course, learn more about your book, Find Freedom Fast, right there as well, right?
That would be, yes, absolutely. The website gives a lot more information, and it's a way to reach out as well. And hopefully the book is good for a lot of people, and they enjoy the read. Sometimes there are some funny things in it as well.
There are. Yeah, we didn't dive too much into it, but you've really mapped out a great journey within this book.
It's a journey of my life connected with strategies that help people get better that I've seen be very, very successful. And it's one of the pleasures of what I do. It's one of the pleasures of being a physician. And it's true. It's not surgery that I originally thought about going into, but this worked for me. And this is part of, I guess, what I'm trying to teach, doing what's best that works for you. And although for a moment or two my dad was disappointed, he certainly joined the club and was so supportive of this. And also, interestingly enough, as a surgeon himself, he started subscribing to psychiatric journals so he could keep abreast of me. It wasn't like he was competing with me. He just wanted to keep the dialogue going. And his advice about doing something different from what was going on at the time was really very, very meaningful. And then my hooking up at New York Presbyterian Columbia was also very good with Dr. Spiegel many, many years ago. It was just very good learning experience. And it carried me through my career. And I'm still trying to do it.
Well, you are doing it, and your book, Find Freedom Fast, is a great book. It's a great read. You know, Doctor, thank you so much for taking the time to be on the show with us here today.
Well, I thank you for having me. You got me doing a lot of talking, I'll tell you that. You're a great, you ask very good questions, but you're a terrific listener, which is really maybe more unusual than you realize in today's world, listening.
Well, thank you for your kind words, Dr. London. It has been such an honor to spend this time with you, and of course, to talk about your new book, Find Freedom Fast, Short-Term Therapy That Works. Again, you can find Freedom Fast at Amazon, Barnes & Noble, and all indie bookstores. You can also visit Dr. London's website, findfreedomfast.com, for more information about the book and also the work he does. Well, we're at the end of our time today. I would like to thank everyone for tuning in. You're listening to Moments with Marianne. And remember, make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Moments with Marianne airs every Sunday, Monday, Thursday, and Friday at 8 p.m. Eastern and 5 p.m. Pacific Time. Make sure to tune in and visit momentswithmarianne.com for more information.